Namaskar, I am Dr. K. Agarwal. Welcome to our webcast. Today we are going to have a different subject, and that will be covering the dental aspects of medicine, dental aspects of human body. And with me I have Professor Dr. Mahesh Verma, who is Padma Shri awardee and who is currently the Director Principal of Maulana Azad Institute of Dental Sciences at New Delhi. But before I go to the dentistry, Dr. Mahesh Verma is also known for a person who likes to change his visiting card every 6 months. He has designed over 50 visiting cards, and people like to keep it with them. They like to, just like stamps, people will look forward and collect his visiting cards, and which he has a collection of over 50 cards by now. So welcome to our show, Dr. Verma. And my first thing which always starts, worries me, it's always have an impact in my mind, is that why dentistry? Why shouldn't we have a separate eye or an ENT or bone, something? We have all specialties together, but dentistry is different. Why? There has to be a reason.
Yeah, this question intrigued me as well when I joined dentistry. That why dentistry, is although part of the medicine, but still an independent program. But when I got into the history, I found that 200 years back, it was part of the medicine. It was one of the areas of medicine. In other words, if I say that at that time we used to have primarily surgeons, and those surgeons were doing medicine and they were also doing dentistry. If you look at the history of royal colleges in England, Edinburgh, Glasgow, Ireland, if you look at their faculty, their presidents, most of them are dentists as well as all surgeons. So it was, but probably I feel that over the years, because dentistry was predominantly biomechanical, it involved a lot of gadgets, a lot of equipment, a lot of materials, and a lot of procedures, which one had to develop, kind of a very hardcore skills. So probably it got separated, and over the years, dentistry as such also, developed, it specialized, it diversified.
That can happen even in ophthalmology.
Yes.
You have total diversification in ophthalmology.
That's right.
There also you are dealing with only 2 small eyes.
Yes, that's
So
right.
here you are at least dealing with 32 teeth. So that could have happened. But what I'm trying to say is that in a BDS course,
Yes.
How many years is anatomy?
Yeah.
The whole body.
Yeah. Yes, this probably would be very interesting, that a dental student, only in final year, that means in the 4th year of his studies, studies dentistry, only dentistry. From 1st year onwards, he studies all medical subjects. Like in 1st year, he studies anatomy, physiology, biochemistry, and then we have one dental subject. In 2nd year, we study microbiology, pathology, pharmacology, and we study one dental subject. 3rd year, we study general medicine, we study general surgery, and then we study. No, we don't study gynae. But general medicine, general surgery, and we have long cases, short cases, all the systems of the body are taught to us, because you see, you cannot separate mouth from the body. Mouth is very important.
If an MBBS doctor wants to do MDS,
Yes.
can you do that?
It's many universities till today had a condensed program. Those who've done MBBS, if they spend, say, probably a year or so, they can do a BDS. They can do BDS. And I have known many of my colleagues who've done medicine, and afterwards they did BDS, then they did MBS, and now they are hardcore dental specialists. So it is possible.
So in dentistry program.
Yes.
There is a program available post MBBS
Yes.
of a shorter duration.
Yes. Yes. Condensed program.
Which is not there in MBBS.
Which is not there in MBBS.
Okay, in MBBS, there is nothing like after BDS, because I know one of my classmates joined MBBS after doing BDS and he had to do a full course.
Yes, yes.
But what you are saying is after MBBS, there is a short course,
yes,
course
to do BDS.
How many years?
It is because some of the universities are offering it. I think it's about 2 years. And all those subjects which were actually part of the dental curriculum, which MBBS would not undergo, will do that, and then he becomes.
But then he can do MBS after that.
He can do MBS after that, surely. After that, he can do MBS. See, there was a time when dentistry was not so developed. It was viewed differently. But today, because dentistry is dealing with appearance, with smiles, with looks, and I think any specialization which is dealing with, because today everybody wants to look smart, look happy, look cheerful, and I think that is why specialties like plastic surgery, skin, and all those which is dealing with appearance, so I think those are doing well. So dentistry in today's time has become, it has grown into.
I'm going to come back because primarily this is being watched by healthcare providers.
That's right.
90% of them would be MBBS or people dealing with modern system of medicine.
Yes.
So let's only talk about two things. And in the last 5 minutes, we'll talk about what's advancements in dental care.
Yes, sir.
But at the moment, let's concentrate on two things.
Yes.
One, when to refer.
Yes.
Two, aspects of dental care which every doctor and every public should know. Basic dental care which can be done by a nurse, by a paramedical worker, or by an MBBS doctor.
I think something which is very integral, whether someone is a healthcare professional or a citizen or anyone, is that how to maintain oral care or oral health. See, the best part of dentistry is that most of the dental problems are preventable. See, there are a lot of diseases in our body which are organic diseases which cannot be prevented. But I think 95% of the dental problems, if taken care of, can be prevented. See, predominantly dental caries, gum diseases, periodontitis, oral cancer, even to some extent malocclusion, that means irregular teeth, oral cancer. Some of these conditions can be prevented. If a child is prone to have irregular teeth and if it's...
So let's have one by one.
Yes.
Let's have dental caries.
Dental caries.
What to do?
Dental caries, because see, most of the dental problems, the main cause is neglect. Not maintaining oral hygiene.
What to do?
Yeah, what to do? See, brush, floss, rinse, swish, clean the tongue. Because see, mouth is a very unique situation where billions of bacteria, they live all the time. And they're just looking for an opportunity to get into the body. Get into the body blood and, have its effect. So, our effort has to be that we do not want these bacteria to build up. And
so let me ask specifically. Rapid fire.
Yes.
I want to brush.
Yes.
Before food, after food.
Before food as well as after food. Twice. Once in the morning and once in the night, but then everything is done. It's not possible to brush all the time after food. At least I can rinse and swish.
So one is that early in the morning,
Yes.
and then while sleeping.
Just before go to sleep. Yeah, because
So first is before eating.
Yeah.
The next one is after eating.
after eating, that is your entire day.
That is brushing. What about floss?
Floss, again, same in the morning. Because see, this is
And
one.
the floss is not available.
Floss is not available, I don't think there is a substitute for a floss. Ordinary thread, it may get stuck, it may injure the gums, because see, floss is waxed, it is kinder, it can slip in nicely. So I don't think there is any substitute for floss. But interdental brushing, vigorous cleaning,
Second is flush. Third is rinsing.
Yeah, rinsing.
Now, rinsing means what?
See, we all enjoy food. We live, some of us live to eat good food, isn't it? When we eat food, we want the taste to linger on. We don't want it to get rid of that nice, lovely taste. So we do not rinse. After that, we want that, the effect. So I think we must remember that you enjoy your food, let's get rid of it now. Go, any place, go rinse vigorously. So whatever food debris is there in the mouth is removed, because that food debris would be attacked by bacteria, and all the byproducts of that, degradation of food will bring about caries, gum disease, and all the consequences, bad smell.
So brushing, flossing, rinsing.
Rinsing. Swishing, again, rinsing and swishing is a little more aggressive, You see, remember olden days when dadas and nanas used to eat food, after that they used to kangalo, mouth with a lot of water. See, so swishing and then cleaning tongue. You see, most of us think, okay, we've cleaned our mouth, cleaned our teeth, but, billions of bacteria remain in the burrows of the tongue, and that must be removed. And the best way to remove is brushing it. We use a tongue scraper, and sometimes we hurt the tongue, it starts bleeding. Best is to use any toothbrush, keep a separate toothbrush for the tongue, and use the toothbrush to clean the tongue, and because the bristles of the brush will be able to get into the furrows and remove all the food debris. Because, so you will feel fresh, nice, the feeling of well-being will come immediately after you've done that.
See, naturopathy says,
yes,
एक उंगली से दांत,
yes,
दो उंगली से मसूड़े,
जी,
तीन उंगली से जीवा,
जी,
ठीक है? तीन उंगली से आगे का जीवा and तीन उंगली से पीछे का जीवा, ठीक है? And अंगूठे से तलवा.
Yeah. So yeah, because basically you are doing a kind of a physiotherapy of all the soft tissues, toughen them, activate them, so that they also, they are also able to thwart, the effect of bacteria and its products, toxins. So basically, brushing also is kind of, when we say do massaging, that's what it is. That's also a physiotherapy. So brushing, massaging, flossing, every is contributing to improving the oral health.
The second thing is, then we do a hand wash.
Yes.
There is a campaign called Campaign 20.
Yes.
How do I know I have hand washed it or not? So the Campaign 20 is make sure that it takes 20 seconds.
Yes.
That's it. That's a Campaign 20.
That's right.
If you take 20 seconds, then you will find that you have done all the steps of hand wash.
Yes.
So make sure that you are following hand wash is the formula of 20.
Yes.
Similarly, in oral cleaning,
we have 2 minutes. We have a 2 minutes regime. At least 2 minutes.
So that means oral cleaning has to be 2 minutes in the morning.
Minimum 2 minutes. No minute. See, many of us, we are in a hurry. We have office to attend, so we just take a brush, take the paste and just rings around and then.
So is there any division of these 2 minutes?
Yeah, it's a division. We start from one end of the mouth and slowly go.
How much out of 2 minutes? How much time should be brushing? How much time should be flossing?
Brushing alone is 2 minutes. Flossing is separate. Cleaning tongue is separate. So brushing has to be at least 2 minutes. Then only, and that also, if you have the right brush, if you have the right technique, you'll be able to do it. Because just spending 2 minutes and if you're not doing it properly, so it's actually, one has to learn it. One has to know. You see, basically,
if you're watching this program and then just kindly note it down, are you spending 2 minutes or not? And you'll find that maybe 60, 70, 80% of us are not spending 2 minutes in the brush. At least I don't. I know that. It's a learning for me that 2 minutes only should be done on brushing. So let's now go back. He says the right brush. What do you mean by that?
Yeah. Before that, I want to tell you that how do you know that you complete your brushing? Okay, 2 minutes sometimes. We are not using watches. But I feel that after you've done your brushing, you run your tongue on the chewing surface, inner side of the teeth, outside of the teeth. And are you finding it clean? It's like after eating imli or tamarind, do you find your teeth very clean, isn't it? Because that's an acid and it just dissolves a little bit of enamel on the surface. And so you should have that feeling that the teeth are clean. If you still feel there's a muck, there's a dirt still stuck between the gums onto the teeth, I think your brushing has not been fine, even though you spent 2 minutes. Okay, coming to the question, brush. You see, most of us buy a brush, whatever size it may be, whatever brand it may be, and we tend to use it for months together. See, brush is also something like, because it loses its effectiveness, its efficiency in a couple of days. And so we need to buy a soft brush. Many of us buy a very hard brush. We think hard brush can clean better. So it's not the rigidity of the bristles. It's actually the technique. And we want to be kind to our gums. We want to kind to our teeth. We don't want to abrade them like a sandpaper. So soft brush with a smaller head. Why smaller head? We want it to reach at every nook and corner of the mouth. Many a times we have brushes which are big and which can only clean the front teeth and we cannot reach behind. Because, see, mouth is a very restricted area. There's a tongue, there are gums and there's a throat behind, you have a palate, soft palate. So, we have to ensure that the head of the brush reaches everywhere and we are able to clean. So, soft brush, small head, and, no particular brand, but anything which you can hold well and you can. Another thing is that don't brush horizontally. I mean, in my professional career, I've seen each one of us, most of us, and why we cannot do it? Because what happens, when we brush horizontally, it causes nicks at the necks of the teeth. See what happens, the neck of the teeth gets, eroded, abraded. So it causes, pits there. And that is also one of the precursors for the dental decay, or the teeth become very sensitive. The gums get, horizontal brushing, you're also hurting the gums. The gums get receded, gums get inflamed, gums get injured. So, the trick is that since the teeth are not flat, they are irregular, so we must clean upper teeth downwards and the lower teeth upwards. Both. Another trick is that we never clean from the inner side, like most of our healthcare professional palatal side or lingual side, inside. We don't do that. We only do it from outside and just let it go. So that is also. And then the third most important, the chewing surface, because that is the surface where the decay will start. The chewing surface, all the surface where we eat the food, because it has a lot of fissures and it has a lot of crevices, because that is the design of the teeth, because that's how the food gets, get crushed and chewed. So that is where the first area for attack. So that also is. So sometimes we just clean from outside, inside we never clean the chewing surface. So this is to be done, and there is an order. Start from one side, go all over, come on the lingual side, then chewing surface. Similarly, on the upper teeth, start on one side, go all over other side, on the palatal surface, and then chewing surface. After that, floss, clean your tongue, and I think you're ready to go.
What about babul and neem and?
That's all fine. If you see some of our, brethren in the rural areas, I know I have lived in a gaon for 6-8 years, till in middle I was in the gaon and he was doing datun. So datun is okay as long as you're not doing anything. But see, datun cannot reach every part of the mouth, and especially on the lingual side, palatal side, and and then secondly, the datun, it's a natural fibers. It is, it is not so effective in cleaning it. Of course, it will do some partial cleaning. But then people also get the babul ki datun or neem ki datun has some chemical. That's okay. That's okay. But basically, chemical is fine, but we want every surface, all surface of the teeth, and not only teeth, junction between the gum and the teeth, because that's where all the problems start. So that needs to be cleaned. And I think a brush would be, and brush is not very expensive.
It's fine. Once I've done the brushing and I want to now rinse,
Yes.
in rinsing, what are the alternatives available to me apart from water?
No, water is the best medium. And of course, sometimes we ask them, okay, put a little salt in it. That's only if we have, if there's some inflammation or something, it will have that effect. And many of us also fall prey to these brands of mouthwashes. Most of the mouthwashes has alcohol in it. It has also a drying effect. Some of them have chemicals, which can also, on a long term, can cause staining of the teeth. So, it is not right to use these mouthwashes on a longer time on your own, unless prescribed by the doctor. And if there is a gum disease, if there is a phase where you feel that okay, we need to augment, we probably prescribe a mouthwash. But I think mouth or clean water is the best mouthwash. See,
so routine antiseptic is not required
no, it's not
because why people talk about it? Because of neem. Neem is an antiseptic.
Yeah.
And because traditionally it is mentioned neem, so people say that if neem, I'm not using neem, then I need an alternative to antiseptic.
Yeah. Also, and most people think, okay, if you're using a mouthwash, I don't need to brush. I think there's no substitute of a brush. All these are adjuncts. They are only supplements. It's only contributing to your effect.
I come back. You also talked about your prevention of irregular teeth.
Yes.
How do we do that?
I'll tell you. See what happens when a baby is born. The first tooth is cut in about 6 to 7 months. And then by 2.5 years, all the baby teeth are there in the mouth. And then the first permanent teeth, pakka dant, that comes at the age of 6 years. So at the 6 years, a child has pakka dant as well as all the milk teeth, and it continues till about 11 to 12 years because other permanent teeth, premolars and molars, incisors come at the age of 7, canine about 10, 11 years. So, that is a stage where there's a mixed dentition. There's a permanent teeth, and many times, sometimes, some parents, they feel if a permanent tooth is decayed, they think it's a milk teeth and they don't neglect and sometimes they even get it extracted. So, you see, there is a concept that if a child is likely to get irregular teeth, there will be telltale signs and they will have some problem during their milk teeth. And if you start, looking after that, we plan the extraction so that the permanent teeth come at the right place, serial extractions. And there are some such efforts done by a pediatric dentist or an orthodontic specialist so that the teeth fall in place. And many times when we think a permanent tooth is coming and it is likely to cause irregular teeth, we extract it, planned so that it does not contribute to remaining irregular teeth. But even if irregular teeth are there, today we have these orthodontic treatments, which are quite accessible, quite popular, and olden time the concept was okay, only irregular teeth or braces, young age. Or today one can have it at the age of 40, 45, no problem. We can even have adult braces today. Some of us who have not got it done during young age, and we still feel that okay, it's not just the looks. You see, another thing is that most people think, okay, braces for looks. No, braces for function. Because if your teeth are irregular, you will have more of gum disease. You can have a TMJ problem, temporomandibular joint problems. You can have so many other associated problems. So, malfunction, so all those things also will be result of the irregular teeth.
So it's important to prevent dental problems, and 95% of the dental problems can be taken care of by taking care of your oral cavity. And that's your personal hygiene. It comes back as a part of personal hygiene. So you need to take care of not only your teeth, but all teeth, inside, outside of teeth, the gums, the palate, and the tongue. And we also know that a proper alignment of teeth is possible at the time when your temporary versus permanent teeth are in phases, and there a good dentist should be able to prevent most of your dental disorders. Now we come back to when to refer. A MBBS doctor, a nurse, or a healthcare worker. What are the warning signals in dentistry that you have to refer a patient?
Yeah, I think since a physician will come in contact, family physician will come in contact with the patient, and the patient will, whatever problem, whether related to mouth, will obviously go to the physician. You see, the physician, most of the physicians have had a posting in dentistry while they are doing MBBS. And so they are aware of today, if there is any telltale sign in the mouth, if there is any issue regarding gums or decay, there are black spots or bleeding gums, or there is a fetor or halitosis, bad smell from the mouth, or any swelling, any gum enlargement, So any of such thing, you see, anything which is there in the mouth, of course, a physician would attempt to treat it at his own level. But today, there is, you see, it's an era of specialization, and many a times, because dentistry is also grown now, pre-cancer lesions, so many other oral conditions, like implants, so many systemic problems which reflect in the mouth, because mouth is a part of the body. It's a part of the gut. The gut's, it's entry point. It's a part of the gut. So a lot of things which is there hidden in the body cannot be seen if there are white patches, the red patches, if there are, some redness, a very different kind of redness. So, the signs and symptoms. You see, patient symptoms and signs elicited by the physician.
Lastly, quickly, what are the branches of dentistry?
Yes.
And then name and what do we do with that?
Okay, we have got 9 specialties in which post-graduation, that is MDS, is being run. MDS is a 3-year program. We start with oral diagnosis, dental radiology, oral medicine. So we have oral physician, dental radiology.
Oral physician is what?
Oral physician and dental radiology is together.
What they will do?
They will do all diagnosis, treat patients for some specialized oral conditions by medication, because they are physicians, and they do all the radiology like cone beam CT or orthopedic. So all the diagnosis, all the diagnosis is pertaining. It's like your radiology. You will diagnose it, and then you refer to the concerned specialist. Number 2 is oral and maxillofacial surgery, where all kinds of surgeries under local and GA is done. Just not only extractions, cysts, cancers, jaw resections, all kinds of maxillofacial surgeries are done in oral and maxillofacial. Then we come prosthodontics and crown and bridge. That is all rehabilitation after jaws have been resected. All the dentures, crowns, bridges, implants. And I want to tell you another thing. We get a lot of patients for maxillofacial rehabilitation. Where the nose has been cut, ear has been removed, eye has been taken, maxilla has been cut, and how these patients face this? So we make artificial prosthesis, and they all come part of the prosthodontics. After that comes conservative dentistry, where we do all the restorations, aesthetic, non-aesthetic. We do root canals, we preserve the teeth, conserve the teeth. We don't extract it. After that comes orthodontics. All the irregular teeth, how they can be. We call it orthopedic or dental orthopedics. How prognathism, retrognathism, how that can be managed. After that comes pediatric dentistry. We have all the up to 14 years, whatever problem they have, because they have to be dealt separately. Then comes periodontics. Periodontics is all the gums, all the problem of the gums that we can treat. Then we have oral pathology. Oral pathology, forensic dentistry, which is part of that, where all these, like your general pathology, where if whatever tissues, biopsies taken, diagnose what is the problem. See, oral diagnosis will do it through radiology and clinically. Oral pathology will do it through pathology. Microbiology, oral pathology, and forensic dentistry. That's all one part. And then we have a very important subject, which is community dentistry, public health dentistry, just like the social and preventive medicine. How do we do? How do we motivate? How do we involve the community?
So general dentistry will be called as general dentist.
General dentist is somebody who's done BDS.
Yes, sir.
Yeah, who's done BDS, who spent 5-year program, who equated with all these.
So therefore, general public should go to a BDS.
Yes.
And let him refer it to one of the 9.
One of the 9 branches if need be. Yeah, and many a times most of the specialists also do general practice, and their focus is on a specialty. Because in dentistry, we don't have that extension system.
That in a hospital.
Yes.
All 9 of them departments will be there.
Yeah, in dental institutions, dental colleges, I think in hospital they may have, they may not have. It depends on the availability of the specialists.
Okay. So ideally, a good hospital should have all the 9 specialties.
Yes, ideally, technically, if there's a big hospital, they should have all these specialties. Yes, definitely.
So dentistry is changing. Cosmetic dentistry, and I'm just talking about aesthetic dentistry, dental implants. So today, my last question is that we had a case we heard a couple of days back
Yes.
that a car chore, a thief,
Yes.
car thief,
Yes.
he changed his face.
Yes, that's right.
And he was caught after so many years.
Yes.
So he changed his identity.
Yes.
Is there a law, is there a regulation governing that? That if somebody comes to you and he says, change my identity, and when you change the identity, are you supposed to inform the police that his identity was before this much and now this much? Because you are changing the identity.
I wish there was something like this, and I want to share with you. I had similar situation a couple of years back, where somebody has come to me, and he said, "I want to change all my caps." And I thought, "You have healthy teeth." I don't know. He said, "No, I want to change my appearance." And later on, I found out that he had married some foreigner, and he wanted to disguise his personality, and he wanted to go to some other. So I wish. You see, of course, every case is not like this. Such cases are very far and few. But I think there should be. If there is anything where you altogether giving a new appearance to that person, and dentistry could be, one of the areas.
By changing the dental structure,
Yeah,
you change the identity.
Yeah, you've seen movies in which Kamal Hassan, he starts looking different, and then he has a different roles and all those. There's a theatric dentistry. Some of the universities abroad, they have theatric dentistry where through dental means we can make somebody look young, old, geriatric, child, so all that. So that is possible, and I wish there was a law like this, that if we are changing somebody's appearance altogether, we should inform the police.
So, dear colleague, I think this was one of a wonderful interaction, and kindly share it with people as much as possible, and pass it on to people, to your students, to your colleagues, because the message for today is minimum to cleaning, minimum to brushing of your teeth, one early in the morning and one late in the night, minimum 2 minutes, minimum 2 minutes, minimum 2 minutes. I'm repeating it 3 times. That's 2 minutes of brushing apart from other procedures. And that's all for today. We thank Dr. Mahesh Verma to be here with us.
Thank you.